Hi guys, and welcome back to our Epidemiology Today channel. It's your boy David here, checking in.
Keith here, and we'd like to thank you guys for all the views and the feedback that we got on our last video on Jon Snow and cholera. So today is a public health segment that we're going to be discussing, and we're actually going to discuss the cyclosporiasis outbreak.
So basically, we found that 3 lab-confirmed cases of cyclosporiasis. Before getting into the details, it's important that we enlighten our viewers what the disease actually is.
Yeah, definitely. I do agree with that, David. And to make it easier for our young scientists, you guys watching at home, to understand, cyclosporiasis is a parasite found in the tropical areas dealing with fecal contaminated water and food contamination. So if consumed in food, it takes about a week before you start seeing symptoms. So it might just creep up on you. Some of those symptoms are loss of appetite, diarrhea with frequent explosive bowel syndromes. Be careful. Weight loss, along with nausea, vomiting, cramps, and bloating. So, just a quick note for you guys. David actually did some research, right, David? You did some research on how it could be treated?
Actually, yeah. So it's treated mainly by antibiotics. So there's 3 types: bacterium, septra, and contrim. So you can take any 2 of these 3. Also, drink plenty of fluids to flush out your system, since it really has an effect on your small intestine. Keynote, guys, if you've been affected once, you can get it again. There's no escaping this one. It can last up to a month, and it's likely to relapse.
Ooh, that doesn't sound like fun. So, based on the 3 lab confirmed cases, we actually found where it came from. So, it actually started in a business meeting dated back in May, and we actually got a chance to do an interview. Pretty much, we got a hold of 27 out of 28 of the attendants, and we took some numbers from it. So we got 87 reported loss of appetite, 75% reported nausea, and then 75% again reported stomach cramps. So you can already tell, because those numbers are higher than 50%, that something's going on here. So the key point, though, the key thing that we took away from it was that 5 people tested positive for the disease.
Yeah, so based on the cohort study model, 16 out of 27 met the case definition. And we obviously sourced it back to what they consumed, and we looked at what they ate and what they drank.
Yeah.
So we actually found that they mainly came from the berry dessert. So they all ate this berry dessert, and it contains strawberries. Another restaurant, which we looked at, where 9 out of 10 were interviewed, and they all met the case definition. And this was from the berry dessert. Looking closer at the dessert, it was made of strawberries, blackberries, and raspberries. When eating a strawberry, 7 out of 7 became ill. So between the cohort studies, it's hypothesized that the illness came from the strawberries.
Thanks, David. It's actually cool because a public advisory in Texas was made to wash strawberries very thoroughly before eating them. So, I mean, in fact, if you have a compromised immune system, I think, for example, off the top of my head, I'm thinking compromised immune system. So people undergoing chemo, or people that are vulnerable, like people that have HIV, the advisory states that you should just avoid them entirely. So imagine you got to avoid something that's considered healthy, so it's not fun. So according to CDC, just a side note of that, CDC is the Centers of Disease Control and Prevention. There are actually 800 confirmed infections in 20 states. Now that is insane. And here we're sitting thinking that, oh yeah, grab some strawberries, man. It's good for you. It's funny, man.
That's not it.
No. So discrepancies, actually. But I mean, on a side note of that, discrepancies have been made as well. But it's funny because it's actually leaning more towards raspberries. So we talked to 725 affected people who attended 55 total events, and raspberries were served at 54 out of 55 of these events. Now that's a 98% success rate. Well, I mean, like, it's not really a success, but for us, for finding's sake, it's really good. So 11 of the events hosted only raspberries, though. So diving deeper, we had to investigate exporters and distributors working with these specific berries. So we narrowed it down to 4 main exporters, and in Guatemala is where we're really sourcing it out to. And Guatemala is actually the exporting heavyweight, and they had a 72% influx of infected berries. Let's just cross that one off the vacation list.
The farm supplying the main exporter
Yeah.
uses well water stored in mesh-covered, plastic-lined reservoirs. These are very vulnerable wells. The wells were filtered to remove debris, but they didn't remove the microbes that contain the virus and human waste, actually. So really gross. Other farms they got their water from running river, so this water was okay. So CDC and FDA later determined that the raspberries were sprayed with insecticides and fungicides mixed with the contaminated water. So due to the runoff into wells from the sewage pits and latrines, nice. Key info. So even if they were washed, they're still contaminated. So concluding that, raspberries were likely the source of the outbreak, not in fact strawberries.
Interesting, actually. So, I mean, after this, Guatemalan exporters improved the sanitization, employee hygiene, and water quality. So the outbreak actually, but after this outbreak, the outbreak came back the next season, which rose attention once again and resulted in the volunteer suspension of the exporting farms. Guatemala obviously didn't want to give themselves a bad name. So no more outbreaks came after this, but the funny part is that Canada said they would still accept them, and then 300 people became infected just in Ontario. Go Canada, eh? So this intensified the suspension, and now there are very, very specific criteria in what's allowed to be sent out of farms. So as of now, only 3 out of 85 Guatemalan farms still export raspberries.
So to wrap things up, the take-home message is to be very mindful of where your food actually comes from and the sanitization methods that the farmers are using to prepare and send food overseas. All right, thanks for watching, guys. Make sure to like, comment, subscribe, share this video with all your friends.
And after sharing, make sure if you have any questions that you comment below.
Yeah, thanks, guys.
Thanks, guys.
Bye. It was just like